What time? What time are we going to stop? I think we still have the time, not so? Derek, don't we?
We
It's
had
10
said
past
at 4, but now it is 4.
We are stopping
Past
at what
4, yeah.
time? Hello? We are stopping at what time?
Now,
We
Huh?
had said at 4, but now it is
Who
already
is
past
talking
4.
that one? Alonda, you are the one. Eh?
Yes, doctor, somewhere I think we
Hello?
had said we come back for 2
The
hours,
problem is
but
we
now it is
started a
past.
No,
bit
no,
late.
no.
Hey,
At least that one did not come from my mouth.
hey, it was just a
Now I'm
suggestion.
trying. No, when the
So we
lunch
can
you had
continue
for 1
30
hour,
minutes to counterbalance.
you had the lunch for 1 hour and there were internet interruption here and there. Eh? Then now
Yes.
can we stop at 4? Eh? Anyway, I will summarize and see how far we can, what we can push. You know, when we don't meet every day. So when we meet once like this, we need to do maximum. Eh? So that
Doctor,
by the
but
time you rest for a week, at least you are loaded.
Doctor, these
Yes.
things are very crucial and we have to follow the steps so that we don't do witchcraft on the work. Then we say, you didn't teach us well. So too much may be also not good.
This is not too much. This is enough. I want to give enough, not too much. Eh? So I wanted to tell you a story. We had somebody, I think when I just completed my first degree. What happened is we went for a training. It was an on-site training in one of the hospitals. I will not mention the name. So what happened is the team from Ministry of Health came and started teaching us on HIV transmission and what have you. So they started by giving pre-test. So when they gave pre-test, people did it. Eh? Then somebody, I think, in the pre-test got like got 0%. Eh? So then the person got 0%. Then of course they were giving money. Of course, you know, most of the workshop they are facilitated, and people are already aware that they give money. So some people go not because they are interested in learning, but because they are interested in that money. But since for you to get the money, you must be there, then they will go and be there physically. Eh? So now they taught us for like around, I think about 2 weeks, every day for 2 weeks. Then after that, they gave us another test, post-test. Now this person still got 0%. Now Ministry of Health, those team, they became concerned just to have the person now. Because many times they are not obliged to disclose. Eh? But they felt they are also carrying responsibility. They called the matron of the hospital privately and talked to the matron. Eh? And now this person, do you know you are a nurse who is like this? Eh? And the person claims to be a graduate nurse, a nurse with a degree. That's why they were more trouble. So the sister said, yes, I know. But what do you say about this? How can you, of all things, how can you, in HIV, how can you get 0? When everybody knows about the mode of transmission of HIV and some questions are related to that, and the person cannot write anything meaningful. Plus many other things about HIV, you get 0. There now, if you look at the record of attendance, the person has been attending throughout the 2 weeks without missing, and was active in the class. Then after that, you give another post-test and the person still gets 0. Then the matron became concerned because the person claimed a done a degree in nursing from what? From Makere. Then, now when the matron started investigating, and when the word started telling the matron how they are also worried about that person. But for them, they are also querying that passion too much. But for them, they thought maybe this is the people are not informed. So maybe that's how it is. That's how they were buying time with this lady. But now, from their assessment, this lady doesn't know anything. And the matron decided now to call the lady. Remember, after the workshop ended, they signed for money, people went away. The lady now refused to appear. Do you know what happened when we investigated further? We found this was somebody who stopped in senior six, but she was masquerading as somebody who is in Makerere University doing nursing. And every holidays, the person would know the schedule of university students very well. So that when people are for holidays and they are going for placement in the hospital, the person also plans and joins them, claiming that she's part of those students. Eh? So it is that bad baseline, setting baseline indicators, very, very important. You need to know the situation before, so that you are able to tell the situation afterward. So, sorry. When you are setting target, baseline indicator level plus desired level of improvement you want to have equals to target performance. Target performance, this desired level performance to be reached within a specified period of time. But what you want to improve, the desired level of improvement you want to cost is you now to think about it. So you assume a finite or an expected level of input, activities, and output. And you add on to the baseline. When you add it to the baseline, you expect to achieve certain performance target. So what is the role of target? And tracking progress toward achieving target is okay. It assists in what? In resource allocation. And what I'm trying to say is that when you are setting target, it also helps you on how much resources you should allocate for that activity. If you are setting target, maybe the current, what is our current maternal mortality ratio in Uganda? Who knows it? Is it 300 and what? 300 something or is it still 400? 360, is it 60 something or 30 something? So if you want to bring maternal mortality ratio to 0, then it also tells you how much money you should put for maternal health. I get the point. So we are saying setting target is often a requirement in performance-based funding, where the funding is based on how you have performed. Of course, sometimes people manipulate the process and what have you, but basically that is the guideline. So, somebody's talking, Roy, mute yourself. You know why we mute ourselves? I want your noise to affect you alone. Unfortunately, if the noise is in my background, then it affects all of us. But the one that is yours should affect you alone. We are now 47 people in class. So if the noise is affecting one person, then 46 will be understanding, 46 will be learning. And now if you make your microphone loud, it disorganizes all of us. So what are the main steps when you are setting target? These are straightforward stuff. You define the population and the subpopulation in need of your services. After you have defined the population and the subpopulation, number 2, you assess the existing coverage of the, to identify the gaps that exist. Then number 3, you determine the level of what the potential achievement you want to make. Remember, you already know the gaps. So you determine the potential achievement with time frame, given the resources that you have, given the opportunities at your disposal, given the constraint. Be very mindful about that because they are very important. If you don't take it into consideration, you'll end up setting unrealistic targets. Hey, what is happening? So then after that, after determining the potential achievement you want to have, then you go ahead and you set your target. And your target should be ambitious, but yet very realistic. Don't set target that you can achieve within, maybe your project is for 3 years, but you can achieve it within 4 months, and you are done. Then you begin to boss around with that. That means it is unrealistic. So the target should be ambitious, but at the same time should be realistic. Not too much, not too low, but sufficient. So if you want to set target, you go through those 4 steps. You determine, you define the population and the subpopulation. You assess the gaps or the coverage so that you are able to determine the gap. There now you determine your level of what potential achievement you want to make. Then you proceed and set the target. Now, when setting target, there are some factors that you need to consider. One of them is the baseline. You must have clear understanding of the baseline starting point. And you must take your baseline very, very seriously. 2, previous performance. You need to consider previous project performance. If you have ever done you have ever implemented such a project in the past, then take that as a learning point. Try to weigh out critically because it will help you in setting your target. Then 3, resource availability. Be very mindful about the amount of resources you have. Funding and level of personnel resources expected throughout the target period, very important. Then what about additional resources? You could be having additional resources that you know or you expect. So be mindful about that as well. Amount of outside resources expected to supplement the program, very important. Then 5, be mindful about the political concern. Take note of all the surrounding political concern because they can affect you. They can make you overachieve or underperform, either way. Sometimes you may want to cause improvement when the captors have captured that population for their mission. So they are not interested in your achievement. They are not interested in you improving the life of that community. Because when you improve, they will have no work. So be very mindful about the political concern. Then we also have institutional capacity. Check your institution. Does it have capacity to do this or it doesn't have? So when it has the institutional capacity to achieve the target, then you proceed and you set the target. So that means the target that you set should be within the means that your institution can achieve. So we are saying that take note of the following. Only one target is desirable for each indicator. This is a guide. For every indicator, you must set one target if possible. If the indicator is new, then be careful on setting firm targets. Preferably set a range, use a range of targets if you are using new indicators. Then most targets are set yearly, but some could be set even quarterly. Others set for longer periods, but not more than 5 years. Don't set target that lasts more than 5 years. So it takes time to observe the effect of improvement. Therefore, be realistic when setting targets. Be very realistic when you are setting targets. Last but not least, targets should be feasible given all the resources that you have or which are at your disposal. So I have this example. Now, let's look at this example in the table very well. This is an example of setting target. You have a column for indicator, you have a column for baseline, you have a column for milestone 1, milestone 2, and then target. Sometimes you can leave out milestone 1 and 2. You have baseline, you have target. But if you feel you should have this milestone to check whether you are heading toward the right direction, well and good. Our indicator is proportion of girls in project areas who report living free from violence over the past years. At baseline, they were 10%. Proportion of girls who are reporting that they're living free from violence. So you are interested, your interest is, you want at least 50% of the girls in that location to live free from violence. So when you have done your baseline, you found 10% are reporting. You can set milestone 1 that after 1 year, maybe you need 25% of them to be reporting. After 2 years, 35% should be reporting. Then after 3 years, you want 50% to be reporting. Then that means when you have reached the end of the first year, you can do a survey and find out how many are now reporting. If you find it's less than 25%, then it can tell you that you are not heading toward the 50% that you are aiming at. We also have another one, number of children completing 1 year of basic primary education. Maybe at the beginning, nobody is completing a primary education, but your target is that at the end of 5 years, you should have 1,200 completing. Then you proceed appropriately. Another one, capacity of supported partners to develop on project proposals. This is a qualitative indicator, ladies and gentlemen. Take note of this. This is a qualitative indicator, it is not in numbers. Capacity of supported partners to develop on project proposals. So at baseline, maybe people have no ability to develop independent project proposals. Then as milestone 1, now partners can develop proposal with assistance from supporting agencies. Milestone 2, partner is capable of developing independent project proposal. Then the final target is that at least 2 project proposals are favorably received by donor agencies. So you are migrating from no ability to some ability or to even submitting. Then you also have this policy on use of common grazing land exists. Maybe at the beginning, there's no policy about grazing land. Then milestone 1, local government officials have agreed to look into the issue. Looking into the process of looking into the issue is now beginning to exist. So when you realize that people are now beginning to look into the matter, then you say, now this will be my milestone 1. Now when a new policy, a new proposed policy is outlined and is sent out for consultation, people begin to do consultation over a new policy that is about to come into play. Then you say that is my milestone 2. Then now the final target is when the policy on the use of common grazing land is fully adopted by local government. Then you say, now this is my final target. So you are migrating from baseline going towards what target, but it is ladies and gentlemen, on this point?
It is clear, doctor.
Okay. So the rest you can revise at your private time. So you can also have this. This is more what this is quantitative. Remember, there are those columns for milestone which I've deleted. So if you think you don't need milestone to help you to measure whether you're going toward the right direction or not, and you have decided to omit it, is also okay, but you must be very careful. You can also have indicators similar to this. Let me see how much I'm left with. Indicator reference sheet. Good indicators. Okay, I think then I'm about to stop. So I think, Derek, I will also send for you this slide. But the one for yesterday and today, I've already sent. Have you got it?
Yes, I've got it and already given to the members. Already have it as well.
Okay. Let me stop on this quote, maybe over, if I can. So indicator reference sheet. What is an indicator reference sheet?
Excuse your doctor, just the last slide before this one.
Yes.
There was some that on of percentages or something I wanted to comment about here.
Yes.
Yeah, this one here, I wanted to ask because here I'm seeing the baseline is 40, and then the target is something like 30%. I thought normally when computing this, the baseline is expected to be a bit lower than the target one wants to achieve. So I'm wondering why the baseline is greater and again the target is lower than the baseline.
I like that. The question of Lokot is very, very interesting.
But
you know,
also,
when
doctor,
people, just a minute, when people are dying of disease, you cannot say your baseline, you have done baseline, you find 10,000 people are dying per day due to the disease. Then you set your target that I'm going to administer this intervention. At the end of the intervention, if there were 10,000 people dying, there must now be 30,000 people dying. Because it must go up. Then that one means you are a terrible killer. And nobody will allow you to implement such project. The whole world, nobody will allow you to implement such. Are we together, Paul?
Yes, yes.
So if it is to do with death, they expect you to reduce. If there were 10 people dying per day due to a particular disease, you must administer an intervention where at the end of the intervention, the number of deaths should reduce. So now you are setting the target. If it should reduce, you want it to reduce by how much?
Okay.
So this is what we are calling that there must be program logic. There must be logic in what you are doing. It's not just about the numbers. Is that okay, Paul?
Understood, sir.
You have understood.
Yes,
So
yes,
that one I've
yes.
given it as an example, but you can have many others. I'm seeing some people have their hands up.
yes, doctor, I was the first saying something. Paul was asking that question, but to me, Paul has not seen the indicator. There, the indicator is saying percentage of targeted children suffering from diarrhea. So the percentage, the baseline is 40. But your interventions are to reduce these cases of what? Of diarrhea. So you cannot put your target to be high, meaning Meaning, if you put high, you're like increasing the number of cases of children suffering from what? From diarrhea. So
Yeah,
you first.
Maybe a sick here, what you do is, if maybe diarrhea in children is by rotavirus.
Yes, doctor.
So that means if your intervention is to introduce rotavirus into children, then the number of the target will be higher. It means you will give them more rotavirus so that all of them will now, if possible, will get diarrhea. They are now that intervention, nobody will allow you to implement it because it is suicidal. Okay, thank you for that addition, Rasul. Alonda, your hand is up. Your hand was up, but you have lowered it.
I just wanted to answer Lokute. Before looking at the target and the baseline, you have to first understand the indicator. When he asked the other question, but you answered.
Very good. Very good. Thank you for the addition. So before you set the target and the baseline, you must have a thorough understanding of your indicator. What is this indicator? What is the definition of the indicator? You need to understand it very well. If you don't know, don't hurry to set target and baseline. Don't, because you will be disappointed. There was a hand up also. The person has lowered the hand. I didn't cram it.
It was actually me. I was also still looking at Lokut's question. So I was looking at an example of, but I think who has you've already written that you have to understand your indicator definition for you to come up with it as well. So I think that clarifies everything, because there's also going to be but some indicators you may not actually you may actually have to look at other variables. Say, for example, the incidence rate in that place, depending on the indicator that you want to look at. Yes, so it is entirely for you to first understand your indicator, then you can now go and define.
You're right. You're right. Thank you. So, look, what you have asked a very good question. You know, sometimes we would have already rushed over this, and nobody would understand it very well. So he has brought this question so that now we can understand this much better. Now, because of the question of the quote, I know nobody can make such mistake unless people who have not been in this class. So indicator reference sheet. What is an indicator reference sheet? An indicator reference sheet, basically what I can say is a detailed document of all the indicators. Maybe you are implementing a particular project. You can create a sheet or a document where you list all your indicators and you give detail about those indicators so that you don't lose track. It entails clear definition of indicators, the numerators for all the indicators and the denominators. It has data collection detail, such as the data collection sources, frequency of data collection, and who will collect which data. But remember, if you already having your M&E plan, then all these are already in the M&E plan. So this might be applicable if you have decided not to use an M&E plan. Then you can also use this tool, the indicator reference sheet. You list all your indicators, all their numerators and denominators, all their detail, the data collection frequency, sources, and who is responsible for what and why. Everything about the indicator is in that sheet. So they call it indicator reference sheet. When I ask you to write short notes about the indicator reference sheet, you should not get confused. So what are the content of the indicator reference sheet? The content of the indicator reference sheet can even be the link result, precise definition of every term used, reason for selection and how to interpret indicators, data requirement, data quality issues, how to measure and calculate the indicator, data source responsibilities and frequency, issues, limitation of the indicators and significance, and also data table at both baseline and target values. So these are the content of what you always populate in the indicator reference sheet. As I've already said, M&E plan already has most of this. So it is better to always have an M&E plan. In the event that you don't have an M&E plan, you can go for your indicator reference sheet. It can also help you. But when you have decided to use the indicator reference sheet, be mindful about the content. What should be in that sheet? Very important. What about good indicators? What are the qualities of good indicators? But before you go to the qualities of good indicators, I think we should stop here. I don't know. Colleagues, are you too tired that we should stop here? I want to get consent.
Yeah. I think we can stop from here, Doctor.
I'm still reaching diminishing returns now.
Who is saying we are reaching diminishing return?
Doctor, can stop here.
My friends, this is serious. Okay, I don't have to insist. So maybe what we will do, I will send the slide ahead so that you can continue to read this in the course of the week. So I know in the course of the week, you'll be very busy. Colleagues, are we together?
Still, we'll squeeze some little time to revise.
And what we
are
have
encountering
covered,
these things for the first time, and the more time you give, the more time they'll also disappear away. So at least if you send it, we'll do squeeze some time and move through it.
Yeah, it's okay. So next time when we stop, we will start from where we have stopped today. And now, when we also, unfortunately tomorrow we will not be there. So when we are not there tomorrow, then that means there's some time that is lost. When some time is lost, then you must begin to find when will you cover this time. Should we create some of the lectures on weekdays? Some few of them.
That one is difficult, sir.
Pardon?
That one, there is a lot of interruption because people are working.
How about tomorrow? Can we have tomorrow? Tomorrow is Sunday.
My friend, tomorrow you go for your God. I don't want to be part of that scene.
That has been your spirit.
Tomorrow, Doctor.
I've been part of the curriculum designers. You're already part of.
Yeah, I want that scene to be yours alone, not that I'm the one who has caused it. So maybe our spiritual leader, you can pray for us, then we go home.
Doctor, I will delegate today.
No, it's okay. We respect you.
Come.
Ronald Sebia, please pray for us.
Can I help Ronald Sebuya?
Please do.
Well, thank you. Let's have ourselves for a word of prayer.
Here I am. I also have to go to heaven. Right.
Father, okay, let's pray, guys. Father, in the name of Jesus.
Here.
Okay, so Ronald, please proceed.
Right. Thank you so much. Let's humble ourselves for a word of prayer. Then, Father, thank you for this day, for bringing us together. Pray that whatever we've perceived today will be for the good of your people. We pray for our lecturers, we pray for everybody. We pray for all those who are not feeling well as well, so that they are able to catch up and get together with us the next lectures. All these I've prayed in the name of the Lord, Father, Son, and Spirit. Amen.
Amen.
Amen. Thank you so much, Ronald.
Thank you very
And
much,
thank you,
Doctor.
Sharon.
Thank you, Dr. Mona.
Yeah, guys, I just wish you all the best. But next
Thank you
week we are meeting physically. I hope you are aware about this.
We are aware, Doctor.